Our next healthcare hero in the behavioral health category is Dr. Terri deRoon-Cassini, Associate Professor at the Medical College of Wisconsin. She is advancing research to identify neurological, biological, and psychological markers that can help prevent the onset of post-traumatic stress disorder. PTSD is most often associated with military engagement, but often affects those who experience traumatic events, such as car accidents or shootings. Research from Froedtert and the Medical College of Wisconsin indicates that up to 40% of civilian survivors develop PTSD. A licensed psychologist, Dr. deRoon-Cassini, started the Trauma and Health Psychology Service for Level 1 Trauma Center at Froedtert Hospital. She provides patient care to traumatically injured survivors who have been hospitalized and has an outpatient behavioral health clinic. Dr. deRoon-Cassini helped launch a collaboration of researchers from the Medical College, UW-Milwaukee, Marquette University, and the Milwaukee VA, dedicated to improving the lives of people affected by trauma through research, intervention, prevention, education, and outreach. Congratulations.
Thank you very much for this award. I'm extremely humbled and honored, and I want to say congratulations to my fellow awardees. Reading about the work that you do is inspiring. I wouldn't be here unless it was the belief of others in me. When I started 11 years ago at the Medical College of Wisconsin, there were not many level 1 trauma centers across the country who had a psychologist working alongside the surgeons. Yet I had leaders that believed in what we were trying to do and also believed in providing holistic, comprehensive care to our trauma patients. I want to particularly acknowledge Dr. Stephen Hargarten. He is the director of our Comprehensive Injury Center. He couldn't be here today. He's out on the East Coast actually working with other hospital systems, trying to encourage hospital systems to donate money for violence prevention. So he's continuing to do very worthy work. He believed in me. He actually responded to an email that I sent him as a graduate student saying, "This is who I am and this is what I want to do." And he actually responded as the chair of the emergency medicine. And we met, and he helped to connect me to the right people to develop a trauma service for injured trauma survivors. I have to say that I have never worked with such a hardworking group of individuals as I do alongside our level 1 trauma surgeons. We are extremely grateful and to have a level 1 trauma center in the city of Milwaukee. I don't know if you know, but there's only one other one in the city of Milwaukee, and that's Children's Wisconsin. And the work that they do and how hard they work is amazing, and I get to work alongside them, and I'm inspired by them on a daily basis. I also want to acknowledge individuals that continue to believe in the work that we're doing. We had a service that was me, a trauma service, and now we have a second psychology faculty member. We have a 2-year fellowship program. We're involved in the health psychology residency program, and we have graduate students that we train. And I truly believe that being allowed to expand the service to meet the behavioral health needs of our trauma patients has been a tremendous leadership effort by many people at our institution. I want to recognize Dr. Mark DeMoya, who's in the room, who is my Chief of Trauma and Acute Care Surgery. And he always is supportive of the work that we're doing and continuing to help us look into the future with more that we can do and innovate. I also want to say that I am inspired to continue to do the work that we do because of the inspirational leaders that we have at Froedtert and the Medical College of Wisconsin, and that includes a fellow healthcare hero, Dr. John Fangman, who's here today as well. It's leadership like that of Dr. Fangman and Dr. DeMoya that encourage us to expand and innovate. I also need to say that with our Milwaukee Trauma Outcomes Project, it's a research collaborative across the city trying to address not just outcomes of trauma, but the disparities that exist within those who are overburdened by the experience of trauma in our community, and ways that we can understand how to treat those individuals better and help them to a more resilient path that leads to well-being. And that includes support from our Neuroscience Research Center, who's here and has sponsored our table today. They have been tremendous supporters of the Milwaukee Trauma Outcomes Project and allowing us to expand the research that we're doing. We have funding from NIH, we have funding from the Medical College of Wisconsin and our Clinical and Translational Science Institute and our Comprehensive Injury Center. And we're very fortunate for that funding in order to really make sure that we speak to the needs of those injured trauma survivors. And lastly, I want to acknowledge my parents and my daughter who are here today, Bob and Corinne deRoon and my daughter Sophia Cassini. My husband and son couldn't be here today, but my family is my inspiration. My work ethic comes from my parents, and they have always taught me that you work hard and you do the right thing. And it's because of them that I've been able to develop in my career, and I am where I am. Thank you.